Hey everyone, welcome to this explainer. Today, we're diving straight into something that is absolutely crucial to our overall well-being, but wildly enough, it's something almost no one talks about. We're talking about pelvic health. We're going to explore exactly how specialized physiotherapy can actually restore your comfort, your confidence, and honestly, your whole quality of life. So let's just start right off the bat with a real question. Are you one of the millions of people silently dealing with pain, or maybe some unexpected leakage when you laugh or sneeze? Or maybe you've just got this lingering core weakness? And more importantly, have you kind of just assumed that this is a normal part of aging, or just par for the course after childbirth? Well, let me tell you, you are absolutely not alone in thinking that. But that assumption, that's exactly what we're going to unpack and challenge today. Because here's the truth. Pelvic health is absolutely essential. It is a cornerstone of our overall well-being, yet it remains one of the most frequently overlooked areas of human health. I mean, it's not exactly something we casually chat about over coffee, right? Because of that stigma, so many people are just left to struggle entirely in silence with issues that literally dictate their daily activities. Okay, moving into section 1, the overlooked core problem, validating the silent struggle. When we talk about the stakes here, we're looking at things like urinary incontinence, pelvic pain, and muscle weakness. And these don't just cause physical discomfort. They actively, day in and day out, impact your normal activities and take a huge toll on your self-confidence. This validates the silent struggles so many people face across all different life stages. Whether you're in postpartum recovery, navigating menopause, or dealing with chronic pain, these disruptions are real, they're valid, and they directly hit how you feel about yourself. So to fix these issues, we first need to understand the anatomy. Section 2, what is the pelvic floor? The foundation of your core. All right, think of your pelvic floor like a literal sling or a hammock made of muscles. This group acts as a physical support system for your internal pelvic organs, specifically your bladder, your intestines, and for women, the uterus. But here's the thing, they don't just hold things up like a static shelf. No way. They play a massive active role in bowel and bladder control. They're central to sexual function, and they're the literal base of your core stability. Think of it like the foundation of a house. If that foundation is weak, or even if it's just overly tense, the whole structure feels the strain. Which brings us to section 3, conditions physiotherapy can treat. The surprising issues linked to the pelvic floor. The sheer breadth of things that specialized physiotherapy can treat is honestly a real eye-opener. We're talking about stress incontinence, that dreaded leakage triggered just by a simple cough, sneeze, or trying to work out. We see overactive bladder, where therapy can actually retrain your body to reduce that constant urgency. It also covers painful intercourse, which is super often linked to muscle tension, and remarkably, it even addresses diastasis rectus abdominus. Actually, it surprises a lot of people that this abdominal separation, which happens so often after pregnancy, is directly treated by focusing on the pelvic floor. Throw in complex conditions like interstitial cystitis and pubic symphysis pain, and you quickly realize this isn't just a list of ailments. It's really a map showing just how interconnected our core and pelvic muscles are. Let's zoom in on one specific and frankly often misunderstood condition, pelvic organ prolapse. The name sounds pretty intimidating, right? But breaking it down takes away a lot of that fear. Remember that hammock analogy? Well, when the ropes, meaning your muscles, become too weak, the organs they support, like the bladder, uterus, can physically descend or drop from their normal position down into the vaginal canal. But here is the great news. Physiotherapy focuses on strengthening those exact support muscles, tightening up that hammock, which can drastically reduce the symptoms and improve the physical support for those organs. Now, you might be sitting there wondering, how does this actually differ from going to my regular physio for, say, a sprained ankle? Well, while general physiotherapy is fantastic for your outer musculoskeletal system, pelvic health physiotherapy requires highly specialized, advanced training. These practitioners are specifically trained to evaluate and treat the internal muscles, tissues, and organs hidden deep within the pelvic area. It's a completely different skill set, perfectly designed for a completely different set of challenges. So, how do experts actually go about treating this? Let's get into section 4. Inside the treatment process, demystifying your clinic visit. The whole clinical pathway is incredibly structured and, most importantly, supportive. It doesn't all happen in a rush. Step 1 is a comprehensive initial assessment, usually lasting a full 60 minutes. This is where your physiotherapist dives into your medical history and you chat about your specific symptoms, whether that's pain, leakage, or bowel challenges. Step 2 involves subsequent targeted treatments that usually run about 30 to 45 minutes. And step 3, which is where the real magic happens, is the introduction of independent home exercises and techniques. Because the goal isn't to keep you in the clinic forever, right? It's to empower you to maintain and build on your progress at home. I do want to highlight a really crucial reassurance regarding the assessment phase. Internal examinations are completely optional. Yes, evaluating the internal muscles is incredibly valuable for getting a precise diagnosis, but it will only ever be performed if you are 100% comfortable with it. The entire process is completely driven by your comfort, your privacy, and your consent. Period. So what actually happens during the treatment phase once you've been assessed? Well, it involves a highly customized blend of evidence-based techniques. This might include specialized manual therapy to physically reduce muscle tension and get the circulation flowing. It'll definitely involve targeted pelvic exercises to build up your strength and coordination, but it goes way beyond just muscles. Practitioners will actually work with you on retraining bladder habits, educating you on proper body mechanics, and even offering practical lifestyle guidance. It really is a wonderfully holistic approach to getting your entire body working exactly the way it's supposed to. Ultimately, all of these clinical steps, all the assessments, the exercises, they all loop back to one primary mission: restoring your strength, your function, and your comfort. By tackling issues like muscle tension, weakness, or hormonal impacts head-on, evidence-based pelvic floor physiotherapy empowers you to build real resilience. The whole point is giving you the tools to take back your day-to-day life without any hesitation. So I'm going to leave you with this final thought to consider. What would your daily life actually look like, and what would your daily confidence feel like if you didn't have to silently worry about unexpected leakage, core weakness, or pelvic discomfort ever again? The knowledge and the specialized care are out there waiting for you. Thanks so much for joining me for this explainer, and I'll catch you next time.